Hyperbaric Oxygen Therapy is a forearm treatment used to help people in many ways. And this segment, sponsored by Harch Hyperbarics Incorporated, Dr. Paul Harch joins us to explain the benefits of hyperbaric oxygen therapy. Good morning, doctor.
Good morning.
All right, first, I want you to just share with our viewers a little bit more about you, how you got started, how you became really internationally known for hyperbarics. It all kind of started here.
It did. It's a real Louisiana story, and it was almost accidental. I came down here to work at Hotel Dieu Hospital in emergency medicine. I found my way into the group of doctors here that had all of the diving practice, so treating all of the divers from the Gulf of Mexico, commercial sports scuba divers. And we made a discovery. We found that we could treat the ones with brain injury long after the U.S. Navy told us they were treatable, meaning we could treat people with chronic brain injury. And once we made that discovery, we started asking what other types of brain injury would respond. And next thing you know, we were looking at people with boxers, traumatic brain injury, stroke, children with cerebral palsy, autism, and a wide range of conditions now.
So you guys really discovered the ability to help these people, like you said, long after.
Yes.
But it wouldn't have happened anywhere else because you had the divers right there
Exactly.
out in the Gulf.
I mean, hyperbaric medicine has been around for 366 years now, but this never happened because it wasn't in the right place. And we had the divers, it was on the West Bank where we had a little clinic and we were able to practice medicine, and this just all happened.
For someone who isn't familiar with hyperbaric therapy, what is it? How is it helping people?
It's a treatment that uses two natural ingredients, increased pressure and increased oxygen.
Okay.
And when you do that, you're able to treat people with wounding conditions and inflammatory conditions, which is a wide range of conditions. In fact, you know, wounding, we're usually thinking of a wound on the outside of the body, but we don't think of internal wounds as wounds. A stroke is an internal wound, a heart attack, neurological conditions.
Hasn't it been proven to treat carbon monoxide poisoning as well?
Yes, yes.
So there are a number of ways that you can use it, proven ways that it can be helpful in kind of these critical situations. And
yes.
Can you give us a little more on like how it works?
It's basically a gene therapy.
Okay.
And nobody has understood this until 2008. But when you go in a hyperbaric chamber, a single treatment has been shown to turn on or turn off over 40% of all the genes in our chromosomes. In particular, the anti-inflammatory genes, the growth and repair hormone genes, and suppress those that cause inflammation and cell death. So every treatment stimulates tissue growth, inhibits inflammation, and turns off cell death.
So if somebody feels like they would benefit, or they know somebody who would benefit from therapies like this, what does an appointment look like with you? How does it all work?
Depending on their condition, their severity, etc., it's a 1 to 2 hour meeting. A complete history and physical. We go over everything, head to toe. A very extensive exam, and then I discuss with them their condition and what literature has shown benefits or not for it, and whether we have a good chance of helping them with this therapy.
So you try to be very evidence-based in your practice?
Very much so.
And when people do get a hyperbaric therapy, what does that look like? Is it a machine? Do you go into a canister? How does it work?
It's a great question. Most of them, they come in all sorts of shapes and sizes.
Okay.
They're essentially an enclosed vessel. Some of them you can sit in, others stand in, walk in, but the ones we have are clear acrylic cylinders with a metal end on each end that opens, and you lay on a stretcher that slides in, and when it pressurizes, there's some warming. And after it's at the depth or pressure that you're at, you don't feel anything.
I was going to say, can you fall asleep? Can Mama take a nap while we're doing this?
In fact, it makes people a little bit sleepy. Okay. Most people nap in the chamber.
Okay.
Within 15 minutes, I have a hard time staying awake in the chamber.
While they're being healed, they're relaxing.
They are.
And getting a good nap in.
Very healing environment, yes.
All right, Dr. Harch, if someone wants to get in touch with you, what is the best way to reach out and get that appointment?
The easiest thing to remember is HBOT.com.
Okay,
so hyperbaricOxygenTherapy.com.
Okay, HBOT.com, making it nice and easy for folks to get that first appointment. Thank you so much, doctor. I appreciate it.
Thank you.